reconstruction as a response to that injury. Another one is what we call primary hemostasis. You see again in biology, in hematology. For that case, there will be involvement of coagulation factors. Like this one, Van Willebrand fact. It also there will be aggregation of the hemostatic plaque and the recruitment of those collagen. Secondary hemostasis, there will be also some tissue factors, phospholipid complex expression, and some tissue, again, for formation of the fibrin. Once the fibrin is formed, there will be also degradation fibrin, because that fibrin, it is hard mass. For the maintaining the homeostasis, this one must be fibrinolyzed. In summary, formation of the blood clot complex, it has several steps. Blood clot, there's endothelium, and the coagulation. Coagulation cascade is very, very complex. We will see it in hematology. There's some process, and that one is what we call coagulation factor, exposure membrane, van Willebrand factors, and here those inhibit thrombosis, the antithrombin 3 and the thrombin. This one, that cascade of the coagulation, it is involvement of the fibrinogen. Fibrinogen is factor 1. Coagulation cascade. This one, it is very complex. We can't see it here now. It will be another chapter in hematology when you start the coagulation. After that formation of the called fibrin, there will be also system where there's involvement of the plasminogen, plasmin, formation of that fibrin clot. Then there will be fibrin degradation. So we don't go into those details of blood coagulation. It will be another chapter. So what you must know. Sorry, some people are disturbing us. In summary, what you must know in thrombosis, there's the formation of blood clot. And in the blood clot, there is endothelium, platelet, cascade. There's three influences of the thrombosis: endothelial injury, alteration of the normal flow, and hypercoagulability. Hypercoagulability, this one is that cascade of coagulation when there is an increase of the factors of the coagulation. They say when the two are both present, endothelial injury is not requisite, meaning that alteration of the normal flow and hypercoagulability, this one also can intervene alone in thrombosis. This one, that cascade of the coagulation. So for the arterial injury can be caused by ulcerative arteriosclerosis, what we have seen before. Transmural myocardial infarction. We're going to see what the infarction. Vasculitis, inflammation of the blood vessel, trauma, injury, physical injury. Radiation and bacterial toxin, as we have seen in shock. There will be alteration in normal blood flow caused by platelet activated by contact with the endothelium. Slowed flow, retardation on activated clotting factors and hepatic clearance. Stasis or turbulence retard in the flow of the inhibitors. Turbulence may also induce endothelial injury. Hypercoagulable test, this one can be primarily by genetic with the antithrombin S3 deficient or protein C deficient. Secondary can be bronchial bed rest mobilization. For example, if you have a fracture of lower limb, then you will be immobilized for 1 month, 3 months. There will be stagnation, no drainage of the blood, and then there will be blood clot. A tissue damage in the case of the myocardial infarction. So in myocardial infarction, tissue damage like surgery, fracture and burns. Also cardiac failure, some cancer. They can cause hypercoagulability, which leading to blood clot formation. Secondary, they can be atrial fibrillation. There's a cardiopathy disease, nephrotic syndrome in kidney, hyperlipidemia, late pregnancy, and post-delivery. For example, late pregnancy can also cause the blood clot because of loss of drainage of lower limb. Then you'll be the lower limb swelling because of the stagnation of the blood. Even post-delivery, because there will be rest on the bed more than 3 days. Can cause oral contraceptive, they can cause thrombosis. Thrombosis, an increase of platelet, sickle cell anemia. Do not disturb. So it is an image showing the. So here there is a blood clot. Here it is case of the thrombosis. Thrombosis and the formation of blood clot, thrombus. This is the thrombus in the blood vessel. Type of the thrombus, it can be white thrombus, red, mixed, or fibrin thrombus. Here we see an image of the white thrombus on the heart valve. The platelet here. Mixed thrombus, the heart chamber, it has platelet, fibrin, and red blood cells. Here it is within the lumen of the blood vessel. This is a thrombus. This is the red thrombus, made up of red blood cells. Earring thrombus, it is a fibrinous thrombus, are visible within the part of the capillary of the glomerulus. This one, this one, this one. Remember in the story that this one, the glomerular. This is the Bowman capsule. Effect of the thrombus, there is absorption, organization, there can be calcification, and then detachment of that thrombus. This is during this is in the case of absorption, organization of the thrombus, dissolve the blood could flow again. It's the thrombus. The effect of the thrombus can cause ischemia, reduction of the blood in tissue, congestion, that is stagnation of the blood, heart valve disease, DIC, disseminated intravascular coagulation because of that disturbance in the blood clotting, embolism, it is that migration of that thrombus in the other site. So the section C is embolism or embolus. Embolism is partial or complete obstruction of some part of the vascular system by any mass carried there in the circulation. The transported material is called embolus. So embolus is that process of obstruction of some part of the vascular system by that circulating mass. It can be even a thrombus. But when in circulation, it is called embolism. So 99% they are thromboembolism, meaning that thrombus will migrate to another part. Type of the embolus, thromboembolism, the most common, fat embolism, air embolism, amniotic embolism. Let us see the fat embolism. This one is fracture on the soft tissue, and this one, most of the time, fat embolism, it occurs after a fracture of the femoral fracture. You will see in your clinical practice, you will see an old man or male, more than 70 years old. After 5 years of a fracture, they say there is a death. When they say there is a death, immediately you can think is fat embolism. Because on the opening of the fracture, there will be clot of the blood mixed with the fat, and this one will migrate to the pulmonary blood vessels, and then immediately there will be death. It occurs around 3 to 5 days. This is why when there is an fracture, the older people, you give anticoagulant medicine. So the main cause here will be pulmonary insufficient and neurological symptoms. Here in an image of the fat embolism, you see here the blood vessel, here there is blood clot, and here there is fat. So this, it was before a thrombus, and then when the circulation it will be embolus, this one will migrate to the lung, and then there will be obstruction of the pulmonary vessels. Air embolism, it is gas bubbles within the circulation and can obstruct vascular flow. This one occurs in intravenous therapeutic procedure, obstetric procedure, and chest wall injury. You will see in your clinical practice when you open that catheter of perfusion, the air will go in the blood vessels. Then there will be blood vessel disturbance, turbulence, and this one will cause a embolus, thrombus. That thrombus will migrate to the lung. Immediately there can be a sudden death. So this one can occur in the chest wall in the obstetric procedure. When you do a C-section, you have to protect the blood from outside. Amniotic fluid embolism. This one can cause a sudden dyspnea, cyanosis, and hypotensive shock immediately on the theater, in the operating room, because of what? Formation of that amniotic clot, which will migrate to the pulmonary vessels, and they will make obstruction of these vessels, and there will be a sudden death. So in that case, I have said this embolization of the pulmonary microcirculation by taking debris of amniotic fluid. Release of vasoconstrictor agent like prostaglandin reduce pulmonary. In this case, most of the time, it is a sudden death to the patient. This is some in the blood vessel. Thromboembolism, most common. Yeah, 5%. This one will cause instantaneous death. %. There will be cardiovascular collapse and the moderate compromised. Small emboli occurs in 6 to 8%. It is a clinical silent in patients without cardiovascular failure. Less case infarction those with compromised pulmonary circulation. Others are very small, which can cause pulmonary hemorrhage and pulmonary hypertension and vascular sclerosis. These are small emboli. Systemic emboli. This one will cause death. 90 to 95 from the heart, secondary to the myocardial infarction. 5 to 10% from auricular thrombosis associated with the rheumatic heart disease and the atrial fibrillation. 5% from the dilated cardiac chambers of myocarditis, in case of the inflammation of the myocardium. There is less common sources like debris from ulcerative atheromata, thrombi in aneurysm, infection, endocarditis, prostatic valve, and paradoxal emboli. Section D is infarction. An infarct is a localized area of ischemic necrosis in a tissue or organ produced by occlusion of either its arterial supply or its venous drainage, meaning that in an infarction, there is a diminution of the blood supply in the tissue. The process whereby infarct is developed is known as infarction. The etiology of that infarction is an intrinsic occlusion, for example, thrombosis, embolism, vasospasm. Extrinsic, for example, twisted of the blood vessels, for example, here in the intestine. Infarction, it has shape, wedge-shaped, segmental, and irregular, and it is a type of coagulative necrosis. They can be red and white infarct. If you still remember this one, an infarct, the wedge, segmental, and the irregular. Twisting of the blood vessels, like here in the intestine. On light microscope, infarction is ischemic coagulative necrosis. It is anemic infarct with few red blood cells. Hemorrhagic infarction has engorgement and hemorrhage. Pathology changes secondary to the infarct, such as hyperemia, hemorrhage, and inflammation. Here there is in case of the myocardial infarct. The myocardial cells show coagulative necrosis with outline of the myocardium. In the margin of the infarct, there are numerous inflammatory cells and the connective tissue. White infarct is known as anemic infarct. This one occurs in arterial occlusion in firm tissue. This is an image of that infarct. Red infarct occurs in venous occlusion, bruised tissue, tissue of dual circulation, tissue previously congested, and blood flow establishment. Those are an image of those infarcts. Hemorrhage infarct, known as a stroke. Hemorrhage denotes an escape of blood from the cardiovascular system. Usually, it is the result of the rupture of the blood vessels of the heart. So this is the brain, and here we see the stroke. So as an assignment, you have to distinguish antemortem thrombus and post-mortem thrombus, meaning that before dying and after dying, how is it the thrombus? It is an assignment. And then you write a clinical features of pulmonary embolism and the stroke. So any question before I go to the exercise? Any question?
No question, lecture.
Okay, we can go, if there's no question, we can go to the exercise given. So one of your representative can share those exercises, then you try to answer the question. Share us the exercise. Share us the exercise, please. Share the exercise. Who can read and give us the answer?
The following statements are true. A. Mural thrombosis in left ventricle may embolize to the brain. B. Thrombosis occurs in the brain and arteries. Vascular endothelium produces thrombin. Atherosclerosis only occurs in right arteries with turbulent blood flow. The pale gray areas in a thrombus are caused by trapped endothelial cells. The answer is B.
The following statements are true. It means that it is not only one.
Okay.
Let us start by A. Is it true or false?
A. It's not true.
Why? You have to give an explanation. Give us the explanation. If we say it is false, why? It is not betting. Give us the explanation. Give us the explanation, please. Yeah, it is true because that myelothrombosis in left ventricle will migrate to the brain via the carotid artery. And the brain is the main cause of the main site of those myelothrombosis. Those myelothrombosis can go also on the below on the liver and the intestine and the kidney. So the answer is true. Thrombosis occurs in the vein and the artery.
That is true.
Thrombosis can be in the vein or in the artery. Number C.
Also, number 3 is true.
Number C is true. Vascular endothelium produced to prothrombin. This is false. Prothrombin is produced by liver, not vascular endothelium. Okay? The vascular endothelium produces what we call plasminogen, not prothrombin. Okay?
Teach lecture. Produce what?
Plasminogen, not prothrombin. Okay, continue. Number D.
Number D, it's false. I think atherosclerosis, it's occur on the arteries, so it is not specific with large artery or small artery.
They say atherosclerosis only in large artery with, it can occur in large and small artery. For example, those coronary arteries. Okay? Number E. This is an English. Turbulent, that's turbulent. Turbulent here in the large, they said it is high flow of the blood. This one occur in large arteries like those femoral arteries, but atherosclerosis can be also found in coronary arteries and some micro and small arteries. That case will cause a dry gangrene. Continue. Number E.
Question. Does arteriosis occur in arteries and veins?
Atherosclerosis is only in the artery, not in the vein.
Thank you.
Number E is false.
Number A.
Number E is false.
Is false how?
I think the reason why those pale gray areas is because those trapped blood cells.
Sorry?
Those gray areas that appears in a thrombus. I think it's because those trapped blood cells, proper white.
Aha. Here they ask, the pale gray areas in thrombus are caused by trapped endothelial cells. No, they are not trapped endothelial cells. They are what? Presence of Presence of fibrin,
Blood.
which is insoluble protein. So it is not endothelial cells, it is a fibrin. Okay, number 2.
Number 2, part A, it's not correct because the increased level of high density lipoproteins it causes
Please, first of all, read the question. The following statements are correct.
The following statements are correct.
Why?
Part A is not correct.
Read the question first of all. Please read the question and then answer.
The following statements are correct. The correct statements, number B is correct. The artery
No, go one
cholesterol
by one.
one by one.
Yes.
Increased level of high density lipoprotein HDL predispose to atherosclerosis. The artery cholesterol levels are directly related to plasma
Hey,
cholesterol
is
level.
it true or false?
A is it's false.
Why?
Why? Because here what we have seen that high level of it's not HDL, it's lower density lipoprotein that increase level of atherosclerosis.
Okay. Number B.
Number B, the question says the arterial cholesterol levels are directly related to plasma cholesterol level, which I think is true.
The arterial cholesterol level are directly related to plasma cholesterol level.
Yes.
Is it true? Is it true? For this one,
Yes, it's true.
for this one, you can say it is true, but the explanation is that high level of cholesterol, it is not always directed to the plasma cholesterol level. Most of the time, there is a genetic factors for plasma cholesterol level. It doesn't mean when it's too much dietary cholesterol level, immediately you have plasma cholesterol level. No, there are some genetic factors in that plasma cholesterol level. It doesn't mean when you eat cholesterol, dietary cholesterol level, immediately to increase plasma cholesterol level. It is not true. Research has shown that there are some other factors related to cholesterol level other than that. But it doesn't mean you have to eat much cholesterol. Okay? Number C. Number C.
The C is
What is the main component of atherosclerotic plaque? Is made up of what?
There is macrophages and migrated smooth muscles.
Okay. Number D.
But I didn't get the right answer for if it is true or false.
What is the answer? Atherosclerosis is an important cause of aneurysm formation. Give us the answer.
It is true.
Atherosclerosis it is true. What is about number E?
Number E is true.
This is true because the atherosclerosis, it is a kind of a thrombus. Now let us go to the number C. Number 3.
Sorry, Action.
Yes.
Yes. We didn't understand the answer you responded to question number C.
So what is the thrombus? It is the formation of that. Is a blood clot. And the atherosclerosis plaque also it can cause a blood clot. Okay.
Yes.
Can you explain for me the number D?
What is the problem?
like the formation of aneurysm due to atherosclerosis.
Yes, aneurysm can cause atherosclerosis can cause aneurysm because if this one atherosclerosis will cause dilatation of the blood vessel.
Yes.
Okay. Let's go to number 3.
The following statements are correctly paired. Lines of Zana in rhombus endothelial cells.
What is line of Zan? Then there are those lines you have seen before, made up of fibrin in thrombus. So they are not associated with endothelial cells. So this one is false. Okay. What is the number? Answer for number B.
Number B is true.
Why?
Because we have seen that those embryos are those thrombus that has migrated.
Yes. Number 3.
Abno-aortic aneurysm, leg ischemia. I think is it true?
Why?
Because according to blood supply, leg, femoral artery comes from aortic abdominal aorta. It's somehow connected. It's connected.
So mean that the leg, when there is a leg ischemia, most of the time it is because of those atherosclerosis in the aorta. Okay, so the answer is true. Number D.
Number D, I think is true.
Why?
Those ventricular mural thrombus, they occur in the wall of the ventricle, so it can cause myocardial infarction, as I was saying.
Yes, it is true. Number E. Cerebral infarction and deep vein thrombosis.
Number E, I think it's false.
Why?
Deep vein thrombosis, as I know it, commonly occurs in the legs. Deep veins in the leg.
Cerebral infarction, most of the time it is in the upper, via the carotid arteries. So deep vein thrombosis will go to the lung. So there is what they call paradoxal embolus. This one, it is when thrombus originating the deep vein thrombosis go to the systemic circulation. In that case, a thrombus can embolize from right atrium to the left atrium via the patent foramen ovary, if you still remember anatomy of the heart. But this one is very, very rare. So this one is false. Normally, deep vein thrombosis are not associated with cerebral infarction, except in that case of the paradoxal thrombosis. In this one, it is very rare, where it is from right atrium to the left atrium via that foramen. Okay?
Okay.
So here there is assignment you have to do. Distinguish antemortem thrombus from the postmortem thrombus. Suppose we're going to examine a cadaver, then you have to know is that thrombus from the before death or after death. And then very clinical features on pulmonary embolism and stroke. Okay. Okay. How many registration number do you have? How many registration number do you have yourself? Yes. It is clear that the assignment is individual. Okay. This one is individual.
Then deadline.
Deadline, it is before the final exam. Okay.
Yeah, okay.
Any question?
No question.
If there's no question, I communicate that next week we'll have a cut. Okay.
Will it be online or physical?
I don't know now, but what you must know, there will be a cut.
Okay.
I will communicate, but what is clear, next week, there will be a cut. From the beginning, from the introduction until this chapter.
Point noted.
Okay.